Hello everyone. In today's lecture, we'll talk about how to diagnose heart failure. Other than the clinical signs and symptoms, doctors can do a few tests to diagnose heart failure. First is imaging, which includes chest X-ray. That is the most easiest way to diagnose heart failure. This is a normal chest X-ray in which we see that the heart is of normal size and shape and the lung fields are completely clear. However, in heart failure, the cardiac shadow will be bigger than it usually should. Another thing which we look at is the lungs that are not clear. If you remember that in the left side heart failure, there is fluid buildup in the lungs. So the lungs will be congested with fluid. This ABCDE mnemonic is a useful way to remember the chest X-ray findings in heart failure. So first is alveolar edema, also called pulmonary edema or pulmonary congestion. It appears as bat wing opacities in the lung fields. B stands for curly B lines. These are septal lines that run perpendicular to the pleural surface and extend out to it. Cardiomegaly is the enlargement of the heart. Dilated upper lobe vessels means that the hilar vessels are more prominent and fuzzy. And finally, pleural effusion that can obliterate both the cardiophrenic and the costophrenic angles in the chest X-ray. Another diagnostic technique for heart failure is echocardiography. As the name suggests, this echo means that it uses sound waves to look at the function of the heart. In simple words, it is an ultrasound of the heart. It helps us to determine the structure and function of the heart and to establish the cause of heart failure as well. In an echocardiogram, we look at the heart chamber dimensions to see if the heart chambers are enlarged or their structure is normal, if there is any hypertrophy or cardiomyopathy. We look at the valves to see if their function is normal or there is any regurgitation or stenosis that's causing heart failure. Ejection fraction is an important factor to determine the type of heart failure, that is heart failure with preserved ejection fraction or heart failure with reduced ejection fraction. You can see pericardial effusion in echocardiogram, especially in right-sided heart failure. And then left ventricular hypertrophy is commonly seen in heart failure that is caused from hypertension, which is one of the most common causes of heart failure. There is a blood test called brain natriuretic peptide, BNP, that can help us exclude or diagnose heart failure. If BNP value is less than 100 picogram per ml, then heart failure is ruled out. If the value is between 100 to 400, then it's neither specific nor sensitive, so we have to investigate further to diagnose heart failure. However, values above 400 picogram per ml confirm the diagnosis of heart failure. Remember, the interpretation of BNP depends upon the patient's age, sex, and BMI. For example, obese patients tend to have lower levels of BNP. Also, its value can increase in certain other cardiac and non-cardiac conditions, for example, chronic kidney disease or sepsis, etc. Another diagnostic test is stress test. We know that with more activity and exertion, we need more blood. So depending upon how well our heart can respond to that increase in demand, by increasing its activity, we can actually classify heart failure and see how severe it is. Stress test usually involves walking on a treadmill or riding a stationary bike. The classification is known as New York Heart Association classification, and it has 4 stages. In stage 1, there is no limitation of physical activity. The patient is comfortable at rest and they do not have any symptoms with physical activity. In stage 2, there will be slight limitation of physical activity. However, the patient will be comfortable at rest and they can carry out ordinary physical activities without any discomfort. In stage 3, there will be marked limitation of physical activity. They will be comfortable at rest, but less than ordinary activities can cause some discomfort. In stage 4, the patient is unable to carry out any physical activity without discomfort, and they will be short of breath even at rest. Cardiac catheterization is a minimally invasive method. It is done when the non-invasive tests, which we mentioned in the previous slides, are not sufficient enough to determine the cause of heart failure. In cardiac catheterization or coronary angiography, a thin catheter is inserted into the artery or vein, either in the neck, in the upper arm, or groin or upper thigh, through a puncture made with a needle. The catheter is then threaded through the major blood vessels, that is the coronary arteries, into the chambers of the heart. That's it for today. If you liked the video, then do share it with your friends and don't forget to subscribe to my YouTube channel. Take care. God bless you all.